National Registry of Emergency Medical Technicians. Advanced Level Psychometer Examination. Patient Assessment, Trauma. Takes or verbalizes appropriate PPE precautions. Scene Size Up. Determines the scene/situation is safe. Determines the mechanism of injury/nature of illness. Determines the number of patients. Requests additional help if necessary. Consider stabilization of spine. Primary survey/resuscitation. Verbalizes general impression of the patient. Determines responsiveness/level of consciousness. Determines chief complaint/apparent life threats. Airway. Opens and assesses airway. Inserts adjunct as indicated. Breathing. Assess breathing. Assures adequate ventilation. Initiates appropriate oxygen therapy. Manages any injury which may compromise breathing/ventilation. Circulation. Checks pulse. Assess skin, either skin color, temperature, or condition. Assesses for and controls major bleeding if present. Initiates shock management. Identifies priority patient/makes transport decision based upon calculated GCS. History taking. Obtains, or directs assistant to obtain, baseline vital signs. Attempts to obtain sample history. Secondary assessment. Head. Inspects mouth, nose, and assesses facial area. Inspects and palpates scalp and ears. Assesses eyes for PERRL. Neck. Checks position of trachea. Checks jugular veins. Palpates cervical spine. Chest. Inspects chest. Palpates chest. Auscultates chest. Abdomen/pelvis. Inspects and palpates abdomen. Assesses pelvis. Verbalizes assessment of genitalia/perineum as needed. Lower extremities. Inspects, palpates, and assesses motor, sensory, and distal circulatory functions. Upper extremities. Inspects, palpates, and assesses motor, sensory, and distal circulatory functions. Posterior thorax, lumbar, and buttocks. Inspects and palpates posterior thorax. Inspects and palpates lumbar and buttocks area. Manages secondary injuries and wounds appropriately. Reassesses patient. Critical fail criteria. Failure to initiate or call for transport of the patient within 10-minute time limit. Failure to take or verbalize appropriate PPE precautions. Failure to determine scene safety. Failure to assess for and provide spinal protection when indicated. Failure to voice and ultimately provide high concentration of oxygen. Failure to assess/provide adequate ventilation. Failure to find or appropriately manage problems associated with airway, breathing, hemorrhage, or shock, hypoperfusion. Failure to differentiate patient's need for immediate transportation versus continued assessment/treatment at the scene. Does other detailed history or physical exam before assessing/treating threats to airway, breathing, and circulation. Failure to manage the patient as a competent EMT. Exhibits unacceptable effect with patient or other personnel. Uses or orders a dangerous or inappropriate intervention.